Human Papilloma Virus. Many people that have sex, they used to catch it from themselves. The Federal Ministry of Health partnered with Gavi, UNICEF. They've supplied Nigeria with more than 7 million doses. My darling Cancer on the Street podcast listeners, I want you to be wise like Solomon. I want you to not think about this thing from a place of fear or I hear they say them.
Cancer on the Street podcast is an African cancer community, collecting wisdom and connecting one another through head and heart conversations and street vibes. Each episode weaves stories from scientists and researchers generating new knowledge, cancer survivors and changemakers sharing their stories of hope. The Cancer on the Street podcast is for extraordinary people by the people's oncology.
Hello, everyone, and welcome to another episode on Cancer on the Street podcast. I'm your host, Dr. Omolola Salako. Today, I'll be talking to you about a trending topic, something that is going on like right now on the street. People are hearing about HPV vaccination for young girls, virgins. Should they do it? Should they not do it? So I'm here to clarify this point. Mommies and daddies, what you need to know about HPV vaccination is very, very simple. Now, in Nigeria, the federal government of Nigeria rolled out a massive campaign for HPV to be supplied to about 7 million girls across the country between the ages of 9 and 14 years old. And the goal is to give these girls these doses of HPV, just one dose, so that we can prevent cervical cancer, so that in future, when these girls begin to have sex as adults, and if they are infected with the virus, the vaccination they took this year or many years ago when they were still small pickings, small children, it will protect them. Unfortunately, many people don't understand the benefits. Many people were just told to bring their children and they didn't understand what the vaccine was about. So a few people are kicking against it. But first of all, I want you to know something, that the Federal Ministry of Health partnered with some strong people who know what they are doing. And honestly, it is good intention. So the Federal Ministry of Health partnered with Gavi, UNICEF, people who are protecting children and ensuring that children across the world are not exposed to this virus. And so they've supplied Nigeria with more than 7 million doses. So our mommies and daddies, those of you listening, those of you that are making decisions about whether your girls, young girls between the age of 9 and 14 should go to the primary healthcare center for this vaccination, I want you to know that it is good for you to let them go and get vaccinated. And the reason is simple. You see, me, my own work every day is I treat cancer patients. And I treat some women that have cervical cancer. Do you know that cervical cancer is caused by this virus that we are talking about, that we want these girls to be vaccinated against? All these my patients that I'm treating with cervical cancer, do you know how much they are spending? They are spending close to 5 million, 10 million, and we cannot even cure them sometimes. But you see, these women that I'm treating, if they had known about this vaccine, if they had gotten it when they were children, the chances that they would develop cervical cancer is very, 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 very little. That's why if you look at Onyibo people, they know they get cervical cancer like that because most of them have been vaccinated. Most of them are screening. But here in Nigeria, many women, they are not screening, they are not vaccinated. So we are seeing 14,000 women every year. We are treating them for cervical cancer. But first of all, let me link how HPV virus and cervical cancer, they are not one. You see that virus, Human Papilloma Virus, HPV. Many people that have sex, they used to catch it from themselves, whether it's man to man, woman to woman, or woman to man. But for this podcast, what I want to explain is what happens between woman and man. Many women catch the virus from the man. And if the woman has the virus, the man too can catch the virus from the woman. But because I'm talking about cervical cancer, I want to tell you what the virus does if a woman catches the virus from the man. Let's say the woman slept with the man when she was 20 years old and she caught the virus. Most times, when women catch this virus, their immune system will clear it out. You know, God give women power to clear all those yama thing out. Unfortunately, there are some people that The virus will not clear. It will just stay there. It will go and find one place. It will go and hide. When it now hide, it will stay there for 10 years, 20 years, 30 years, 40 years. By the time the woman is now like age 50, she will just notice that blood is coming out, blood that she's not expecting. She's not menstruating, blood is coming out. She has even stopped menstruating. She has gotten menopause. Let's say she's 60 or 70 years old. She will just notice blood is coming out all of a sudden. Or she's sleeping with her husband or she's having sex and then blood comes out. This is what the virus can do. It will stay there for many years and it will cause rash. After it causes rash, the rash will become big. It will become wound. When it becomes wound, it brings out blood. So you see this long story that I've said. That virus, she caught it when she was 20 years old. It's become cancer when she's 50, 60 or 70 years old. This is why we're always begging women that even if you have caught the virus, go and do your cervical screening, go and do pap smear, go and do VIA, go and do HPV DNA. Don't come and say it's paining me. Hey, I don't know. I think it will. Go and do it. If you have any of those things, rash, wound, we will see it. We will treat it. Cancer will not start. But back to the virus now. When we are vaccinating small children for tuberculosis, we give them BCG. If a baby has gotten tuberculosis, we won't give the vaccine. If a baby has gotten polio already, we won't give the vaccine. It's the same thing with HPV. If the girl has not had sex, it means it's not likely she has gotten the virus. That's the best time to give the vaccine. So that in future, when she's older, if she gets the virus, she will be protected. So now, what I'm hearing on the streets, and that's why we are here, Cancer on the Streets, to tell you that some people are saying, my child is 10 years old, she's still a virgin, which kind of vaccination you want to give her? Are you sure this vaccine will not disvirgin her? It's a lie. It will not disvirgin her. Another thing that we've been hearing on the streets that people are talking about is that they don't trust the vaccine. They don't know where it has come from. But come on, I want to ask you people, the government and everybody, private hospital or government, they've been vaccinating millions of babies and people and nothing has happened. Just like the COVID vaccine, nothing has happened. So HPV vaccine, there is not much difference. So the way people go in, whether you take a baby to go and take BCG or his COVID vaccine or his malaria injection or his antibiotic injection, is the same thing with HPV vaccine. Once the child goes there, they clean the parts they want to inject. They put the needle in, they inject it. That's it. The standard in hospital is that when you've taken a vaccine, they will tell you to sit down for like 10, 15 minutes to be sure that you don't react. If you don't react, you stand up and go. So some of the side effects is pain when they are giving you injection. There's no injection where they pain small, just small needle and that's it. Then some people may develop fever, but it's not common. But I just want to tell you this. The side effects that people are saying, it causes infertility, the person with this, is not true. Many women, thousands of Nigerian women and children have been vaccinated and they are fine. And what is important is because they've received the vaccine now, if they meet that virus in future, they can fight it and they are protected. My darling Cancer on the Street podcast listeners, I want you to be wise like Solomon. I want you to not think about this thing from a place of fear or I hear they say, them say, body. The HPV vaccine is good. The federal government, state government, they've joined hands with different organizations around the world to make this vaccination available for us in Nigeria. We must do the right thing now so that we can protect the future of our young girls. Bring them out. Let them get vaccinated. The side effects, your concern is valid though, that you are worried, is this right for my child? I hope this podcast has been able to explain that there are more benefits to getting our children vaccinated so that they are not at risk of cervical cancer in future. In fact, if we get it right, if we take all our girls out for vaccination, it's possible by 2050, 2060, that generation, they won't have cervical cancer. Like the way women are coming now with cervical cancer. This year alone in Nigeria, more than 14,000 women have come down with cervical cancer. And they will spend like 10 million naira to get treated. And there's no guarantee for cure because, cancer can be a difficult disease to treat. So now that we can prevent it, I want you to make the right decision. I want you to take the girls out for their vaccination. I want you to look at it from a place of information, not from fear. The people that found the HPV vaccine abroad, they've won plenty award for the good work they've done. If you go and look at cervical cancer, how it occurred in US 30, 40 years ago, thousands of women were having it. In fact, it was the third commonest cancer amongst American women. Many years ago in the 1950s, 1960s. Now, they don't even really have it. Cervical cancer is not a disease they have. It's like the 10th cancer. Why? Because their government has provided screening and vaccination service. And because the citizens, they have gone to use those services. It's a win-win for everybody. So I hope you make this right decision. Take the girls out. Take mommies and daddies, take the girls for vaccination in the nearest primary health care center to you. And mommies, please go for your pap smear screening or your HPV DNA screening and have a conversation with your doctor to find out if you will benefit from the vaccination. The vaccination is best for girls that are virgins, but it's also useful for women who have had sex, who are not virgins, and who have even had children. Thank you guys for tuning in. Please don't forget to subscribe to Cancer on the Street podcast on Apple, Spotify, and other social media platforms. Also, please share, tweet, post, and if you want to take it a step further, you know what to do. Just go and change the name of your Wi-Fi, change it to Listen to Cancer on the Street podcast. That way, every time you're logging into your computer and the internet, you'll see it and then you can tune in. So till next week, we'll be back for another exciting episode. If you have questions, comments, drop them and I'll be looking out for them. See you.